welcome to our discussion, our exploration of the renal system. And in this part, we are going to be learning about the kidney. But specifically, we're going to be learning about the gross anatomy of the kidney. In other words, things that you can see with your naked eye or with glasses, if you wear glasses. So the first thing to realize about the kidney is where it is. It is retroperitoneal. It sits just anterior to the quadratus lumborum muscle and just lateral to the superior part of the psoas major muscles. Okay. And so there are two kidneys. If you look at the cadaver kidney, you can see that the right kidney is just slightly lower than the left kidney, and that's because you have your liver up there in the right upper quadrant. Looking at the kidney, it looks kind of like a bean or a kidney bean. And what you notice is that all the structures are going in and out of the medial aspect of each kidney, whether on the model or whether on the actual cadaver picture. There's nothing coming out of the lateral aspects. And so this area of the kidney, where all blood vessels and any other structures are entering and exiting the kidney, this is called the renal hilum, or the hilum of the kidney. And as I mentioned before, there are multiple organs that have a hilum, so make sure you tell me what organ you are calling the hilum to. Surrounding the entire kidney, there is some dense connective tissue which forms an outer coating known as the renal capsule, which you can see on real kidney. It's usually shown as a dark brown covering on the outer surface of the kidney, whether looking at the entire kidney or looking at a microscopic anatomy model of the kidney. You will see that dark brown surface letting you know this is the external part of the kidney. So just deep to the renal capsule. Have you noticed the word renal showing up a lot? It's going to. Just deep to the renal capsule is the outer portion of the kidney known as the renal cortex. So it's the part highlighted in this pinkish color on the real kidney, and it's the part that is bracketed in the model pictures. And so what do you think is deep to the renal cortex? That's right, it would be the renal medulla. Okay, so the renal medulla is this entire area, okay, that is deep to the cortex. Okay? And in the renal medulla, I think you can start to see that there are a lot of interesting structures going on in the renal medulla, all of which have a name. So the clue for the quiz and test question is if it's name this area or name this structure. All right. So inside the renal medulla, you have these triangular structures, but a triangle in 3D is a pyramid. And these are actually in 3D, as you can see on this middle model right here. And so all of these triangular structures, each one is known as a renal pyramid. And what you will notice is that the points of the pyramids are then pointing towards the renal hilum. So it is wider up by the part closest to the renal cortex and narrower as you get closer to the renal hilum. So the most pointy part, okay, so all of this red area is a renal pyramid. And then the deepest part of the renal pyramid, this part right down here, is known as the renal papilla because it's through the renal papilla that urine's going to be dumping. And so it is this pointy part here. And then on this model over here where you can see all the little openings come in, those are all the little openings coming from the renal papilla as well. Now between the renal pyramids, we have this tissue that looks pretty much like the tissue you find out here in the renal cortex. And so these are columns of tissues that are separating the various renal pyramids. And so each of these is called a renal column. All right, let's go back to the renal pyramids. As I said previously, this is where the urine is going to be draining from the papilla of the renal pyramid. And the structure that collects the urine is known as a minor calyx. And so each and every renal pyramid has a minor calyx. Now, in some places, two minor calyces, as seen in this lower pole of the model, these two minor calyces are joining together, in which case they form a major calyx. In this model, it's these two joined together form a major calyx. In this cadaver one, it's these superior minor calyces joining together to form a major calyx. And then what's going to happen is all the major calyces are going to dump their urine into a collecting area that is still within the kidney. And this area is known as the renal pelvis. And from the renal pelvis, urine will drain through another as yet unnamed structure in the renal hilum. So that is it for the gross anatomy of the kidney. And I will see you again shortly as we learn about the other three structures, the other three organs of the urinary system.